Hi, I'm Jamie, Head of Insight at Creation.co. Recently I spoke at Digital Catalyst 2019 on how to engage healthcare professionals on social media. At Creation.co we often look at the big global conversation of healthcare professionals, but we set ourselves the challenge for this conference being hosted in Newcastle in the UK to look at the local conversation. What does it look like among just the healthcare professionals in the northeast of England? So my team and I took this challenge on, and we found almost 2,000 healthcare professionals just in the northeast of England and North Cumbria, and they had almost 3 million social media posts between them, and it was great to see that on a local level. On this map we can see that there's a few outliers, but primarily these healthcare professionals are well connected with one another, based around primarily the main cities, Newcastle as the key one, and it's just really exciting to see this conversation happening at actually a local level as well. These 2,000 healthcare professionals have almost 8,000 social relationships with one another on Twitter alone. It's amazing to see the role types interconnecting with one another using social media. There's some small clusters of groups. In the orange there we can see physicians, in the green at the bottom you can see some pharmacists kind of clustered together, but primarily there's a real amazing interconnectivity of role types, and that's something we see very commonly on social media among healthcare professionals, where offline you might interact with your immediate peers on a day-to-day basis. Using social media, they can now connect with their peers or also people in different role types, locally or globally. So we've seen that these healthcare professionals certainly connect with one another on a local level, but on this map we can see that they also connect on a global level. From all nations of the world, we can see that there's almost 45,000 other healthcare professionals following this small group of HCPs in the north of England, and over 500,000 other Twitter accounts. So it's really exciting to see there's a great connectivity on that local level, but also the conversations among healthcare professionals in the northeast of England is creating a global footprint. We've also seen that there's a great variety in the role types included in this online conversation. Now traditionally offline we could probably expect to see physicians, and particularly senior physicians, influencing health policy as they are in charge of clinical trials and speak at conferences. But we're seeing an increasing shift in the online conversations where not only do non-traditional role types influence, but they can also lead the conversation. And it's really exciting to see when this goes back into the real world and we see now nurses speaking at conferences and other role types being able to influence online and taking that online influence offline. So we see there's some great data in the northeast of England among healthcare professionals, but what can we do with this? What are the key opportunities to engage these healthcare professionals? Well, I've got 4 points for you, so let's look at those. The first is we need to consider creating content that is suitable for fast mobile consumption. We need to interact with each other's interests. We need to use hashtags to join the right conversations. And finally, we need to keep driving that health conversation. So let's take a look at the way that healthcare professionals in the northeast of England consume their content online. Here we're seeing which device was used to post onto Twitter by healthcare professionals, and we can see that in 2010, 2011 the data is growing and it's becoming meaningful, and the number one device used is web client. Now Twitter as a new social platform was being understood in the same way that we had understood many other platforms. You log onto a website and you use it that way. But actually from the start, we can already see that mobile devices are being used, particularly in those early years, iPhone and BlackBerry, but it was predominantly web client. Now in 2012, we suddenly see that shift where iPhone takes over as the most used platform. Web client is still on a growth trajectory, as is BlackBerry. In fact, all platforms are on their way up, but it was 2013 where the big change happened. Twitter was being understood in a new paradigm as a completely mobile social network. You can see that iPhone really takes off among healthcare professionals, and Android comes in and remains to date as the second most used device to post onto Twitter. From 2012 we can see the decline of web clients and BlackBerry, and in the last few years iPad was increasingly used, but is also now on a decline trajectory. So what does that mean for us when we're engaging with healthcare professionals? What it means is we have to consider that HCPs are almost always on their phones when using their social media platforms. So our content needs to be friendly to that mobile view. It has to be understood quickly, as people traditionally scroll through their home feeds and might flick past things if we can't get to the immediate results. That's the one thing. So let's look at how we can interact with one another on topics. In this way of engaging, we need to consider what is the other people's interests that are using social media that we're connected with. It's great to be able to join in the conversations that we are interested in and add our thoughts and our opinions, share some articles to add to that. But also there might be peers that we're trying to connect with and build that online relationship with that are talking about different topics, sharing from different places. So we need to consider what it is those interests are that we can also take an interest in. The graph here is an example of that. This is data taken from a certain health conversation among North East England HCPs, and it's the sources that they're sharing within that conversation. As we can see, The Guardian was the most shared source in that conversation, and that may not be a source that some of us would go to in terms of a health conversation. You might be sharing from clinical magazines or journals, but it's important to consider what is it the other people are interested in that we can join in and make that a two-way conversation. A third way of engaging with healthcare professionals online is through the use of hashtags. At this point, we're all fairly familiar with how hashtags work, but it was interesting to see that healthcare professionals themselves used hashtags in 27% of their posts online. Now, this might seem like quite a low number, but we've got to consider that some people might post something, add a hashtag, and then others might reply to that in a forum type manner and not add the original hashtag to that. But we can think about how we can use hashtags and how we can encourage healthcare professionals to use hashtags even in those responses to group the conversations together for increased searchability and for increased exposure. A few examples here. These are the top hashtags used by healthcare professionals in the northeast of England. You can see that at number one there is NHS, and a couple that are quite linked to that is hashtag junior doctors, hashtag junior contract. So this was clearly an issue that really was important to Northeast England HCPs. So by looking at hashtags being used as well, we can start to understand, as to my previous point, what is of interest to other people and really make it a two-way conversation. And finally, keep driving the health conversation. I'm really excited to see the data coming out of this one. We see that in 2012, the use of Twitter among healthcare professionals in the northeast of England really took off. And we're seeing about 25,000 posts per month about non-health topics. But even right up till now, 2019, about 25,000 posts per month has remained the average of non-health topics. However, when we look at healthcare conversations, we can see that even though there was only a whispering back in 2012, that has steadily increased to the point where now in 2019, it can be up to half the conversation around health. It's encouraging to see that healthcare professionals see social media as an opportunity and a platform to engage with one another around health. They can talk about the latest treatment options, share trial results, and even talk about public health issues. So let's keep encouraging this. Let's keep driving the health conversation and see how much more we can learn from using social media. So let's recap those key opportunities in engaging North East England HCPs online. Firstly, we're going to create content suitable for fast mobile consumption. We're going to interact with each other's interests. We're going to understand and join in the right conversations with hashtags, and we're going to keep driving the health conversation. It's been a really exciting study, and I'm glad you've got to join in with us. If you'd like to see more of our research, please go to creation.co/knowledge.